Welcome to my first skincare Q&A. I recently had my followers on Instagram submit any skincare questions that they had, and I am going to answer a bunch of those for you today. I'm Dr. Sam Ellis. I am a board-certified dermatologist, and I am here to help you understand your skin and find skincare products that work for you. All right. Here we go. I have tried 20 sunscreens, mineral and chemical, but all of them burn or hurt my skin. Help! That's devastating. 20 sunscreens is a lot to have tried and not found success. I feel like sometimes people will be like, Dr. Ellis, I've tried everything. And really they've tried like 3 things, but 20 that's a legitimate effort here. And there could be many different things going wrong, or at play, I should say. So 1, how is your skin barrier? A lot of people are incorporating things like acids more regularly into their routine, or retinoids, or benzoyl peroxide. These are all irritating skin ingredients, and the skin barrier gets really disrupted. And by the time you go in to put that protective layer on, the sunscreen, your skin can really no longer tolerate it, or it becomes kind of sensitive to one of the ingredients in sunscreen. In my practice, I have found that a lot of patients will complain of stinging if their sunscreens have either fragrance or some form of alcohol. So that might be 2 ingredient categories to look for in your sunscreens, and make sure you've tried some without both of those. The other thing is maybe see a dermatologist. It's not uncommon to have some type of underlying skin condition like eczema or rosacea that make you more prone to irritation, and oftentimes you need to treat that underlying skin condition before you're able to tolerate even basic skincare like sunscreen. There's no reason you shouldn't be able to use sunscreen in your routine, and I feel like that's a really important part of a skincare routine, and you should be able to strategize with a professional on how to incorporate that and how to tolerate that. Is it safe to skip sunscreen for a late afternoon or evening outing? Safe is kind of an interesting word to use here, because there are kind of a few different reasons why I would encourage sunscreen use in general. One is to protect you from skin cancer, and then of course there are all the signs of aging that UV damage can cause, and I feel like half my patients are motivated to wear sunscreen because of the skin cancer aspect, and half are probably more motivated because of the aging part. And I don't care what motivates you, just put it on. But is it safe? So late afternoon, evening, it really depends, where you are in the world, what the UV index is, how high in the sky is that sun still, but probably safe if you're not sitting under like that direct daily sunlight. Maybe you're not protecting from all of the aging that UV light can give you, but really the type of UV damage that is causing skin cancer in my patients is that sort of like prolonged midday sun, day after day, or that intense midday sun that causes sunburns. So if you feel like it's not the intensity of sun that's gonna give you a burn, and you're doing it once in a while, it's probably safe to skip your sunscreen. Exceptions to this would be skin conditions that make you more sun sensitive. So if you have lupus or dermatomyositis, where any bit of UV exposure can really flare your skin condition, then no, it's not really safe to be out there without sun protection. But for me, in the late afternoon or evening, I'm pretty guilty of not reapplying. I tend to use a wide brim hat and sun protective clothing as my method of sun protection later in the day. Skin routine for acne-prone young adult. See you from Colombia. Hey, that's cool. All right, a skin routine for acne-prone young adult. I'm gonna assume you are not trying to get pregnant when I'm giving you this routine. I would say in the morning, using some type of acne targeted cleanser, generally a benzoyl peroxide based cleanser, would be a great way to start your morning. If you have very sensitive skin or just super mild breakouts, sometimes like preteen acne falls into that category, then using a 2% salicylic acid face wash would be a great place to start. After you wash your face, going in with a lightweight moisturizer followed by a sunscreen, sort of a 1, 2, 3 step morning routine is how I would do it. If you tend to not feel like you need a moisturizer, sometimes sunscreen is enough. Most sunscreens are formulated with moisturizing ingredients, so an acne cleanser followed by a sunscreen would also be completely adequate. And then in the evening, I would encourage a double cleanse. I think for people who have acne-prone skin, doing a double cleanse is important because you need to remove all of the grime from the day so that if you're putting on active ingredients at night, they're actually able to penetrate. My first step in a double cleanse is typically micellar water. I love my Bioderma micellar water. I put it on a cotton pad and I would have you just sort of swipe it over the face to remove any sunscreen or makeup or dirt that has built up over the course of the day. And then I would go in with a gentle cleanser like CeraVe Hydrating Cleanser, just something very, very mild that's not going to put any additional pressure or strip your skin. After you have, your skin's totally dried down, I would go in with an over-the-counter acne ingredient that has been proven to improve acne. And my favorite is adapalene gel, 0.1%, probably most commonly known as Differin. And after you put that on, I would put on a moisturizer. When you are starting an over-the-counter retinoid, I don't care how weak it is, I really typically just start with 1 to 2 nights a week. Make sure you can tolerate it and you're not getting tons of irritation, and then slowly increase to every single night over time. Hope that helps. Best affordable product for spot treatment, under $20. I have to tell you guys, I am not the biggest fan of spot treatments. I think anecdotally people say they work and they make your pimple go down faster, but things like benzoyl peroxide and salicylic acid, which are antimicrobial but only very slightly anti-inflammatory, I don't know how much they actually do for the pimple that has sort of already formed. That being said, anecdotally, my patients really love the Clean and Clear spot treatment. I think that one is salicylic acid, as well as the Inkey List succinic acid, which really is also salicylic acid. Just a tiny dot of that on the blemish. Benzoyl peroxide preparations, I find to be just a little bit too irritating. And then a lot of people are using retinol as spot treatments. And that just blows my mind, because retinol isn't even meant for acne. And 2, retinoids work over weeks and weeks and weeks of consistent use. So it just has never really made sense why people use those as spot treatments for their acne. I feel like they're really just causing more irritation. But I digress. I think my favorite spot treatments are really more to help heal spots after they've been picked or popped, because that's a lot of what I see in my practice. So hydrocolloid pimple patches, I know Mighty Patch is a really nice one. CosRx makes a really nice one that's pretty affordable. And these are patches you put on over your pimple, either when it's really juicy or you just popped it and you're trying to draw out any additional fluid and sort of protect the surrounding skin. So those are some of my favorite spot treatments. Using spironolactone as a preventative measure. Is it needed/acceptable? For those of you who don't know what spironolactone is, it is an oral medication. It is a diuretic, meaning that it makes you pee out a little extra fluid, but it also has this lovely effect on blocking your kind of male hormones called androgens from stimulating the oil glands in your skin. So it really helps with that lower face and jawline acne. I don't think doing it preventatively really makes sense. It's safe, my patients tolerate it really well, but I don't think being on oral medication sort of preventatively makes a ton of sense. So if you are getting breakouts and you want to start taking spironolactone and continue because you're worried they're gonna come back if you go off, that's one thing. But if you've never gotten this lower facial acne or that sort of hormonal acne, going on spironolactone preventatively doesn't jive with me. I would never prescribe my patient spironolactone for that purpose. What are your thoughts on oil cleanser for people with acne-prone skin? Thank you. An oil cleanser is really what I think of as a first cleansing step if you're going to be doing a double cleanse. They are so good at breaking up product like makeup and sunscreen. And then really the goal is that you're rinsing them away with water and then going in with a water-based cleanser to do that second cleansing step to remove some of that oil and then any additional debris. So if you have acne, I don't think it's a problem if you use an oil cleanser because it's such a short contact time with the skin. Also, not all oils are comedogenic. So not all oils clog pores and lead to acne anyway. So it's really just, if you like your oil cleanser and you have acne and you don't think it's making it worse, more power to you. I do not think it's a problem. You still with me? How to get rid of congested pores. A question as old as time. I think one thing to think about is, or ask yourself or evaluate is, do you actually have congested pores or do you just have sebaceous filaments? And sebaceous filaments are essentially just the normal lipids, the normal fats and oils that your skin produces to keep your skin well lubricated and protected and prevent water loss from the skin. A lot of people will come to me and they're like, my pores are so congested, and it's actually just normal skin anatomy with normal sebaceous filaments. However, if you look in your pores and they all look black or they look larger than usual, or some are large and some are small, then that might be a sign that you truly have congested pores. With that, we can kind of get into how to treat congested pores. Congested pores are basically oil and dead skin cells that create this little plug that sit in the skin's surface, and they can cause the pore to look much darker and also larger. And really, to go in and fix that, you need some type of consistent exfoliation and some regular cell turnover to be happening. My favorite ingredients for that are retinoids, and then acids like glycolic acid and salicylic acid. Benzoyl peroxide can kind of do that, but to a lesser degree. So for a patient who's coming into me and they don't have like straight up acne, but they just have a lot of congestion, maybe on their forehead, in their sort of T-zone, so also on their chin and nose, what I typically will do is start them on a salicylic acid 2% cleanser, followed by a topical retinoid like adapalene or tretinoin to sort of make their skin turnover more regular. The thing to think about though is if you have congested pores, you cannot expect that you do the treatment for 2 weeks and it's going to work. You are training your cells to turn over in a regular way, but once those trained cells slough off, you gotta train the next set of cells. So you have to be consistent over time. It's not like all of a sudden one day your skin's gonna be like, you know what, we're not getting congested anymore. We're over that. I mean, maybe when you're out of like a decade of your life, but you have to expect that you have to be consistent with your regimen to maintain those results, but also know that it might take 30 to 60 days of doing something consistently to see those meaningful results and see those pores kind of clear out. Is it possible to be acne prone and have dry skin? Everything says acne is due to oily skin type. Fair. Absolutely, you can have dry skin and acne. Acne is caused by a multitude of factors, and oil production is just one of them. Really, acne originates with a plugged follicle, and that can happen just from your skin cells being kind of sticky and not exfoliating in a regular way. So you can absolutely have acne and be dry. It is less common, but it's possible. Is it the sun or the sunscreen that my rosacea doesn't like? I feel like sunscreen aggravates it more. You're not alone in feeling that way, and I find my patients with rosacea may not be able to tolerate all of the same sunscreens that my patients with quote unquote normal skin can tolerate. But one, sun is a huge trigger for rosacea. I think the National Rosacea Society has looked into this, and it's something like 80% of people who have rosacea find sunlight to be a trigger. That being said, there might be some ingredient within your sunscreen, whether that's fragrance or alcohol, or just the combination which leads to the formulation that's problematic for your skin. So sometimes it's a little bit of trial and error to find a sunscreen that works for you, but I would favor that your rosacea flare is more due to the sun than the sunscreen. What treatments do you recommend to your patients with acne rosacea? Having acne rosacea is really not that common. More often, people will have papules and pustules, so the bumps associated with rosacea, and mistake it for having acne, and then they'll see the redness in the background, which is also rosacea, and think that it's rosacea, so then they come to me and say, I have acne rosacea. But more often, it's really just rosacea, which can present in a lot of different ways, including with bumps and pustules, as well as redness and sensitivity. And when I'm treating rosacea, I'm really looking towards prescription medications. There's not a whole lot out there over the counter that I would be like, yeah, this is a real go-to. So I use low-dose oral doxycycline, I use topical ivermectin, I use topical metronidazole, I use topical azelaic acid a lot, I use sodium sulfacetamide, sulfur-based washes to help with their antimicrobial and calming effects on the skin. But what I choose for a patient is always a conversation with the patient based on how extensive of a routine can they handle? Are they willing to take oral antibiotics, or is that like a hard stop for them? How much does their rosacea affect their life? These are really in-depth conversations that I have with my patients to try to put them on a regimen that I think will help them, but also that they're actually going to be able to do and stick with. Is the dryness of retinol part of the purge? Does it go away like acne? If you don't know what the purge is, but I feel like if you're here, you probably do. It's this phenomenon where when you start any type of topical or oral medication that increases cellular turnover, you're bringing some of those deeper microcomedones, those deeper potential acne bumps to the surface more quickly. And so you have this flare of acne before you start getting better. And it's not all that common, but I think people, are rightfully nervous about it because they don't want to flare. But the dryness you get from retinol is really different. The dryness from retinol is because your skin cells are trying to start to mature in a more organized way, but they start out very disorganized, and when your cellular turnover is disorganized, it manifests on the skin as peeling and flaking and dryness. Most people can get over that. That takes about 4 weeks if you're starting out using it every single day. If you're starting out using it more infrequently than that, then it might take you a little bit longer to adapt to the dryness and irritation, which is just a side effect of the medication, but eventually you will. And just a note on that, I feel like a lot of patients, once they stop getting dry and irritated from their retinol, they're like, it's not working anymore. No, it's still working. You've just gotten used to the side effects. So don't feel like your retinoid is ineffective because you're not getting side effects. That's awesome if you've gotten used to it. Tretinoin question. Should we mix it with a moisturizer or apply it after the face has been moisturized? I would definitely put your moisturizer on first and then go in with your tretinoin, or the other way around, put your tretinoin on and then do your moisturizer. The reason you don't want to mix them is because even though in front of your eyes it's gonna look like you have this perfect little combination, on a more microscopic level, what you're really going to have is clumps of tretinoin molecules and clumps of moisturizer molecules. So you might have these like hot spots of tretinoin. So you're not really buffering it the way you might think you're buffering it. So I would much prefer that you do one layer, then the next. And that really goes for all types of skincare. Can you use a retinol if you do weekend outdoor sports, wearing a hat and sunscreen? Yeah, totally. I think the concern there is retinol is thought to maybe increase sun sensitivity, although there's some good data also to show that it doesn't really increase sun sensitivity. But regardless, hat and sunscreen, yes, but don't let potential sun exposure deter you from using a retinol. What is the right age to use retinol and vitamin C? There's really no right age. Vitamin C to me is like an enhanced protective boost to your sunscreen. It is not a must ever, in my opinion. It is really nice to have, but if you went your whole life without using a topical antioxidant or topical vitamin C, but you were really good with your sun protection, you'd be just fine. And same with retinol. Retinol is anti-aging, and people want to know, like, when do I need this retinol, or when do I need this anti-aging routine? And it really varies on when you start to notice maybe those first signs of aging. That might be in your 20s, it might be in your 30s, it might be in your 40s. And when are you ready to commit to that kind of routine? So I think for most of my patients, it's usually like late 20s, early 30s. They're kind of starting to see some sun damage, see some signs of early aging. And I think you kind of need to see it before you start to believe it. And then that really helps you commit to that routine. Is it a myth that you should only use tretinoin 3 to 5 months at a time? What? I've literally never heard that before. No, you can use tretinoin every single day. Yeah, that's totally a myth. What is the best anti-aging treatment for a 32-year-old that isn't expensive besides SPF? I think expensive is really relative, but I would say that using a topical prescription strength retinoid like tretinoin every single night is probably the best anti-aging thing you can do for your skin that's relatively affordable. Does wearing a lot of makeup, like foundation, daily age your skin faster? There is no data that I'm aware of that wearing makeup ages your skin faster. Now, you still want to make sure you're putting sunscreen on under your makeup and that you're removing your makeup every single night, but no, shouldn't be an issue. Botox. Never tried it, but curious. Any advice, tips, things newbies should know? Girl, I could do a whole video on this. I could do a whole Q&A on Botox. And if you want that, let me know in the comments. But I think my best and kind of first and foremost advice is when you're thinking about getting Botox is seeking out a medical professional who is highly trained to do it. Okay, like even though Botox seems so ubiquitous and people are doing it at parties and mixing it with champagne and alcohol and things like that, it's a medical procedure and it really should be treated as such. Beyond that, when you go in for your consultation, you should know that you don't have to get treatment that day. That can be an information gathering session only, and you should never feel pressure to be treated. I'll leave it at that for now. Like I said, I could talk about Botox forever. So if you want more information, let me know and we can talk about it on my Instagram, or I can do a whole YouTube dedicated to Botox questions. Why do some people burn/get tanner more than others? This is a pretty complex question. So try not to go on too much of a scientific tangent here, but Every human has the same number of melanocytes in their skin, and melanocytes are the type of cell in the top layer of skin that produce melanin, and melanin is what gives our skin color, what gives our skin pigment. So although we all have the same number of melanocytes, the amount of melanin produced, the number of melanin molecules, the shape of those melanin molecules, and also how those melanin molecules are distributed within the skin varies based on how dark your skin is. Melanin is very protective against UV damage. So if you do not have a lot of melanin in your skin, if you're very fair-skinned, then UV is going to be able to exert a lot more damaging effects, and that's going to manifest as a sunburn. Whereas people who have more melanin in their skin, rather than just responding to UV damage as a sunburn, they will often get tanner. And sometimes you can fall in between and get a little bit of burn and a little bit of tan. But tanning is a response to UV damage, just like burning is, and it kind of depends on your baseline level of melanin as well as some other genetic factors, whether you burn or tan. Is there any value to regular facial treatments by a cosmetician/esthetician? Honestly, that totally varies based on what kind of facial you are getting, what the experience of that esthetician might be. I think of facials a lot like I think of massages. Like for some people, there's just like this mental benefit to having a procedure like that done. But for some people, there's like a true physical change that happens when they get a massage or they get a facial that is beneficial for them. So yes, I absolutely think regular facials can be beneficial for some people, but maybe not for everyone, and that really depends on the experience of the person doing it, but also just the nuances of the type of facial that you're getting. There are a lot of estheticians out there who are highly trained in skincare, and that's something that often gets discussed while you're having a facial. So the other benefit of getting regular facials is you're sort of regularly getting someone to check in on your skin, and hopefully they're not just trying to sell you a bunch of products, but really teach you about your skin and what products they think will truly be most beneficial for you. And that absolutely can have long-term great effects on your skin. Is there a way to shrink pores? Pores are an anatomical structure. It's like saying, I want smaller ankles. We can create the illusion of that. So if you clean out your pores regularly, they might look smaller, or if you have laser treatments to stimulate the collagen and building blocks of your skin that surround your pore to kind of like make that skin a little more rigid and supported, that can make your pores appear smaller. But no, you can't really shrink your pores. What's your advice about nose strips? Do they become harmful over time? I don't say that word a lot. I hate nose strips, okay? They don't do anything to address the cause of the problem. So you're essentially just like causing physical trauma to your pores, which can make them stretched out and enlarge over time. So, no, I don't like nose strips. The sun is setting, so we might be in the dark here soon. Preventative treatments to invest in and frequency of treatment. Example, microneedling with PRP. So in sort of the cosmetic derm world, we would refer to this as prejuvenation, getting on the anti-aging or well-aging train really, really early. I think trying to counsel someone on when that should start and how frequent their treatments should be and what those treatments are is such a personal decision based on someone's goals, what their budget is, what their skin type is, what kinds of skin insults they incurred when they were growing up. So I think it's really hard for me to make any type of specific comment on this without looking at someone's unique skin in a consultation. I practice a lot of cosmetic dermatology, and probably the most common prejuvenation things we do in my practice would include Botox for people who are not getting those fine lines and wrinkles yet, but want to prevent them from ever coming, and maybe they have intense muscle movements, and so they absolutely will be getting those and they just want to stay ahead of that. Also doing some really light laser resurfacing with a clear and brilliant laser just to keep the skin tone really even, keep the appearance of the pores small, and do a little bit of reversal on sun damage. That is kind of what I like to do. Microneedling is another thing that I don't do as often in my practice. I have such an arsenal of lasers, so those tend to be my favorite go-to toys, but microneedling is something I will do from time to time as well. And then when it comes to how often you're doing these things, that really will vary from patient to patient. When these things are studied in clinical trials like Botox or resurfacing lasers or microneedling, they're studied in the context of treating something like acne scarring or pigmentation or skin tone. And they haven't really been studied in their preventative capacities. So a lot of what we're doing is almost like theoretical anti-aging. Oh, we are done. That was really fun. I hope you enjoyed something, and maybe if you had a similar question, you got it answered. If you want me to do more Q&A videos or cover more specific topics in the Q&As, put it in the comments below. I love hearing from you. Go ahead and give this video a like if you enjoyed it, subscribe to the channel, and come follow me on Instagram. I'll see you next time.